The Windy City, the City by the Lake, Chi-Town are just a few of the nicknames the city of Chicago has. By no means is this a small city. In fact, Chicago is one of the nation's largest and has become a global city with international trade and commerce. Chicago is 227.63 square miles large, with 11,841.8 persons per square mile. The 2012 U.S. Census showed the population of Chicago to be 2,714,856, up from the 2010 census. The city's population is a large mix of races. The groups that are mostly made up of are whites, non-Hispanics at 45%, blacks or African Americans at 32.9%, Hispanics 28.9%, and Asians at 5.5%. The overall population of Chicago that holds a bachelor's degree or higher education is only 32.9%. Most of the people that live in Chicago do not own their own home. They usually rent or rent the home. Actual home ownership is only 47%. This may be due to the cost of homes in the area. The median value for a home is $260,000, while the median household income is only $47,371. This puts 21% of Chicagoans below poverty level. Although Chicago was not truly incorporated as a city until 1837, the first permanent resident was said to be Jean-Baptiste Point de Ciboure from Haiti, who came to Chicago in 1770. In the 1850s, many of the streets were raised 5 to 8 feet above to install a sewage system. These new streets and buildings were made of wood, and most of them burned to the ground in the Great Fire of 1871. However, quickly, Chicago did rebound, and within 20 years, they were hosting the World's Fair. In 1893, we built the White City in Hyde Park, an area in South Chicago. Politicians and people were talking so much about the World's Fair being held in Chicago that people began to say that politicians were windy, and thus the nickname Windy City was born. Chicago, having no luck with fires, lost the famous White City after the World's Fair due to a fire started in a burn barrel. Chicago has a great history and very proud citizens of their city. Religion from Muslim to Catholicism has numerous places of practice throughout the city. Chicago's South Side has the St. Jude's Shrine, which many visit each year. Education is also widely offered in the city. Some of the larger college institutes are Northwestern, University of Illinois at Chicago, University of Chicago, DePaul University, Loyola University, Rush University, and many more. Both community and teaching and research hospitals are located in Chicago. University of Chicago Medicine, Rush Hospital, UIC, Loyola Hospital, St. John's Community Hospital, St. Francis Hospital, Northwestern Hospital, St. Bernard's are just a few. There is a hospital within every 5 to 10 miles from every part of Chicago and free clinics throughout the city. People of Chicago have a vast variety of recreational activities offered to them. There are more than 200 theaters, 200 art galleries, 7,300 restaurants, 26 miles of lakefront, 15 miles of bathing beaches, 19 miles of lakefront bicycle paths, 552 parks, 36 annual parades, and home to sports teams like the Blackhawks, the Bears, the Cubs, the White Sox, and Bulls. Fortunately, Chicago has a great public transportation system. Most of the citizens do have cars here. However, a large population do not. Many partake in the Chicago Transit Authority or CTA's bus lines or the L trains. The L trains are what many would call the subway. However, in Chicago, instead of the trains running underneath the city, they actually are elevated, making them the L trains. They run above the city. Many people in Chicago will also use cabs or bike or walk to their destination. The city's government is divided into executive and legislative branches. The mayor, Emmanuel, is the chief executive, while the city council, elected from 50 wards, is the legislative body. In addition to the mayor, Chicago's 2 other citywide elected offices are the city clerk, who is Susanna Mendoza, and the city treasurer, Stephanie Neely. However, along with all the positives regarding a popular city, Chicago also has many negatives. One of the most well-known gang gangsters of all time is Al Capone. However, now Chicago is just full of regular street gangs. From the gangster disciples to things like the Latin Kings, many of those gangs are taking over parts of Chicago. There were 65 shootings in the first week of July. While most related to gang activity, there are still random acts of violence here. Petty theft, rape, and burglary all exist in the city. An assessment to the community health issue, an issue that's to be centered around the spread of HIV, or the human immunodeficiency virus. According to the AIDS Foundation of Chicago, by the end of 2009, which is when the most recent collections were, there was more than 20,676 people reported as living with HIV or AIDS. Almost 1,000 new cases were diagnosed that year. The majority was within the gay male community, or MSM, men who have sex with men, most between the ages of 20 to 29. African American men accounted for 59% of all new cases. 3 decades into the HIV/AIDS epidemic, HIV prevention programs have been only partly effective. New prevention tools are providing new reasons for optimism. The new strategy is called the test and treat strategy. This is testing often and treating early. However, for this to be more effective, we need to have people treat more often. The ultimate goal of our community education is to promote HIV testing in the community, which eventually will decrease the amount of new HIV infections in this particular health district. Primary prevention in Chicago community starts with education. While gearing education to a younger audience may be effective, we feel at this time we need to make the priority group the 20 to 40-year-old adults. How to achieve this? We're first going to look for volunteers in the community to help facilitate both gathering and teaching. Fortunately, Chicago has numerous universities that always have students willing to volunteer for research projects. Using both medically educated and non-medical educated persons, we will develop a survey to take to the community to find out the biggest misconceptions about HIV and AIDS. Because Chicago is such a large city, we'll start by dividing the city into 3 sections: north, south, and west. We'll start surveys and prevention teachings on the north side and then reevaluate the program before moving into other areas. We're choosing the north side for a few reasons. And this has the largest amount of gay men. They have 2 districts. Boys Town is highly populated with gay men, and Andersonville, which are both located in the north side. Also, because our surveys will be done on foot, gathering from pedestrians, we would choose the north side because it's the safest out of the 3. Also, we're going to work with organizations like the AIDS Foundation in Chicago and the Core Center in Chicago to develop the surveys and implement the education forum. After the surveys are developed, we will approach pedestrians throughout the north side of the city. In Chicago, it's not uncommon for pedestrians to be asked to do surveys while walking down the street. So we'll be giving them the surveys to fill out, and while they're filling out the surveys, we'll also give them handouts on local areas that offer free HIV testing. And we'll explain the whole test and treat to the population while providing the statistics on HIV and AIDS in Cook County. Cook County is where Chicago is located. We're not going to actually put a time frame on how long we're going to gather information using the survey because we want our sample to be a good representation of both genders, sexual orientation, and races. So there's not really a time limit. We understand that it could probably take us longer to do that, delaying the implementation of education, but we feel it needs to be done. Once our sample size has met our needs, we will examine the results. Also, we will ask the free clinics to ask the patient to come in if he or she was sent to the clinic due to our street education awareness. These results also may help us in the future implement different strategies for teaching. Once we have looked at the results, we can then start with education. We can offer classes through the Core Center and the AIDS Foundation. We can also do advertisements by using things such as newspapers like the Red Eye, which is a local newspaper that it's free to everyone, and it has like what's going on in the area from events to crime. So it's a good way to advertise. And depending on our budget, we could also potentially advertise with commercials, billboards on both the L and highways. To gain money, of course, we mainly get through donations. And working with the bigger organizations, we could put together 5Ks and things. Evaluations, though, with this idea of teaching is going to be the hardest thing to accomplish. We can evaluate some things by looking at, after we had the classes, what people's feedback was on that. We can also evaluate by looking at statistics monthly from the free clinics, specifically looking to see if there was an increased number and how many people were tested that month, and also see if there's an increase in positive results. But I think overall the most effective evaluation will be to take the original survey and go back out to the same areas, 6 months out, 1 year out, and see if the answers are different, if they yield different results than our original collection. From that, we can then kind of make changes, and then once we see that the program is moving in the right direction, we can then open the program to the south and the west sides of Chicago and build it from there. However, Chicago is a great place to visit and a wonderful place to live. It is a city that has overcome tragedy more than once, and the citizens, the Chicagoans, are proud of their city by the lake. While the police and the mayor work to fight crime, we can stop this epidemic of spread of HIV and AIDS in the city. Offering our plan of education interventions using the test and treat method, we hope we will meet our ultimate goal to reduce HIV infections within the Windy City.